throughout Western New South Wales and their connections to land, water and community. I pay respect to elders past, present and future and extend that respect and a warm welcome to all First Nations people present today. Tonight we're joined by our panel of experts. Dr. Manoli Abesekara is a consultant endocrinologist and mother of two, a formidable feat. I'm Alex Hall. I'm a rural generalist, GP and facilitator for tonight. We've got Alison Amor, credentialed diabetes educator, Martin Watson, GP in Orange, and Amanda Taylor, who is a credentialed diabetes educator, pharmacist, and tonight's presenter of the didactic session. Um, so, yep. So just a few short housekeeping. Please leave your webcam on. Helps us feel part of a community altogether. Please remain on mute except when speaking, but we do encourage you to unmute and ask questions when you're needed. We remind you to maintain patient confidentiality. We live and work in small communities and it can sometimes be identifiable who we're talking about. Just be mindful of that. As I said before, questions are welcomed and we will be reminding and prompting. Please use the hand up feature or unmute yourself, wave at the screen, or alternatively, if you don't want to speak up, please just type it in the chat and I'll be sure to read it out. And at the end of tonight's session, there'll be an evaluation. Please fill it out and we'll be emailing CPD certificates. So as always, a reminder that our language matters. The words used to talk about diabetes affects the physical and emotional health of people living with diabetes. They also affect how people in society view people living with diabetes. Our words need to show that we care and remove bias and blame. You might ask yourself, people with diabetes call themselves diabetic, so why shouldn't I? Well, evidence shows that 1 in 2 people find the label unacceptable and 1 in 4 find it harmful. People with diabetes are free to use whatever words they wish. Other people, especially those of us in healthcare, have a responsibility to engage all people affected by diabetes in positive and helpful ways. So over to Amanda.
Well, thanks, Alex. I'd just like to take the opportunity as well to acknowledge the First Nations people whose lands we're meeting on tonight, and I'm coming from Wiradjuri country, and I just extend a warm welcome to all First Nations who are joining us tonight on this meeting. So this is just a follow-on. So this is meant to be in April, so which couldn't happen, but this is a follow-on from Alison Amor's session in March, and we'll continue to explore and attempt to understand the unique needs for each client living with type 2 diabetes. Wouldn't it be easy if every client were the same? Imagine that. We could have the same consult for every client living with diabetes, use the same resource, save time, recommend the same diet. But as we know, that's not the case. We are all individual. We all have different upbringings, social circumstances, education levels, day-to-day stresses, family, food preferences, and responses to medication. Person-centered care allows us to focus on individual goals, cultural respect, decision-making, care options, understanding, outcome reviews, communication, and it's a supportive environment. Some tips that for individualised care and support may include understanding a person's motivation and goals relating to their diabetes, and this is crucial for guiding consultations. Setting individual goals developed together encourages clients to have ownership of their health. Keeping the messaging simple. This is their first consult. They don't need to know the pathophysiology at this stage, and some people may never need to know to understand that, to manage their diabetes safely. What is most important that they understand that diabetes is when their blood sugar is high and not low. Being aware of social limitations that could affect their care is essential. For example, a client not getting the expected results due to starting a medication, you might need to consider what issues this client might be having. Costs, availability, tablet size, side effects, storage considerations, family considerations. It is actually something I've seen a few times in my consults, both as a pharmacist and diabetes educator, that clients can admit to me that they're not taking their medication, but then they'll go into their GP and feel like they need to say that they're taking it because it's considered the right answer. Having all members of the multidisciplinary team providing consistent messaging is crucial for ongoing management of clients. Feeling like we're a team supporting their care creates rapport with the client. Effective communication between healthcare professionals is key for this to happen as well. Using person-centered care open-ended questions allows for the client to share their emotions and personal experiences. It encourages the client to express their understanding and knowledge, and this allows for a more tailored and supportive conversation. It prompts the client to reflect on their changes, and it provides us valuable insights into their personal journey and needs. Some of the questions that often use in my first consult with a client are, and if you go to the next screen, Ali, um, so how did you feel when you were told that you have diabetes? Tell me what you might know about diabetes. What does life look like now for you living with diabetes compared to before? Um, Certainly there's many questions we can use in these situations, but it is really important to be authentic in all of your discussions, and it's important to find out what works for you. Diabetes self-management can loosely be categorized into 5 areas. So food and drink, movement, stress, sleep, medications. The messaging around these areas need to be simple. This is their first session. As I said before, they don't need to necessarily understand all of the pathophysiology, and most clients will be overwhelmed about their diagnosis. Be led by the client. You're more likely to get a buy-in and willingness for change if we focus on an area that they're interested in. So while there's loosely classified, as I said, 5 areas loosely, they might not be ready to discuss 4 out of those 5. Let's just focus on the one that they might be interested in. Implementing lifestyle changes in a manageable manner can take time to introduce. For some clients, it may be more important to optimise management by pharmacological measures to minimise the long-term risk of diabetes-related complications alongside the implementation of lifestyle measures. And then we can adjust that down the track. Encouraging for regular appointments with the healthcare team and explaining what the numbers are and why we want them can help a client understand the importance of blood tests and why we're asking for them to see other health professionals such as podiatrists and optometrists. It could be as simple as also demonstrating a basic foot check in the practice and providing supporting resources to help empower the client to recognise changes and when to refer to a health professional. Now for a big debate. To monitor or to not monitor. Blood sugar monitoring can be a useful education tool to assist clients in identifying foods, drinks, stress, sleep that could be impacting their sugars in a negative way. For a lot of clients, this is a source of additional stress in an already confusing, overwhelming period for them. It's important to weigh up why you would like the client to monitor their blood sugar levels and what the client will get out of it. So it could be client started on insulin. So we know that's very important to be monitoring so we can make sure we're getting the right dose for them. It could be the client is showing interest in their readings and what's happening, or trying to help with monitoring or learning about the impacts on blood sugars with food or exercise. If you are asking the client to monitor, some key considerations are also supplying a monitor or how they can get that. Explaining how to use, ensuring that they're registered on the NDSS. And we did talk about this last time, that it's really quick and simple on the online health portal. Certainly reach out if you're unsure about this. Sometimes it can be handy too, also explaining how the consumables are accessed through the NDSS. So for example, Lancets aren't actually covered. So it is important to explain that because sometimes they might think that everything is subsidised. So in summary, the key messages for the client in the first consult out of the first, in the first consult is that they do have diabetes, type 2 diabetes. It's not just a touch of diabetes, it's the full blown. We've got diabetes. It is a condition where your blood sugar levels are higher than normal, but it is manageable and you can live well with diabetes. And the aim is to keep your blood sugars in a safe range. For clinicians, it's celebrating the small wins with your client. person-centered care is a journey and it can take time to develop. So also to be kind to yourself and to be reflective in your practices. Work on SMART goals with your clients and treat your clients as you would want your loved ones to be treated. Really, if you can treat everyone like that, everyone's going to be getting everything that we need. That's me done.
Thanks, Fernanda. Any questions on the presentation tonight? Was that, you had an extra question, Ellie? Was that it?
No questions for me.
Thanks for that presentation, Amanda. I think, it is just this information overload when you give someone a diagnosis of type 2 diabetes. And I really appreciate how you've sort of, I guess, crystallized and simplified it into manageable chunks. And I think, it is a journey and it's not something where, particularly in the GP setting, you can't impart all of that in 15 minutes or less. It takes time and it takes repetition and it takes effort to get there. So I really appreciate what you've communicated tonight. Thanks. Al.
Yeah, Alex, I just wanted to build on that and just share with the audience. So we recently had a consumer reference group, which was composed of people who had been living with type 2 diabetes. It was a really broad criteria. And interestingly, the really strong feedback that came back from that consumer reference group was around how overwhelming the diagnosis was and how scared they were when first hearing about diabetes, and that in some ways they felt that health professionals were somewhat desensitized to what the impact of that diagnosis might feel like. And one of them said to us that they really believe when someone's being delivered the news that they've got type 2 diabetes, it should be treated the same way that you would treat delivering the news that someone has cancer, because all of the participants in their own way told a story about after leaving that consultation and hearing that news, they had an emotional breakdown away from the health professionals. So I think, I can reflect on that as well and think, I probably am a little bit desensitized to the impact of what a diagnosis might have. And it was just a really enlightening experience to be a part of, to hear that feedback.
Thanks for sharing that. I think, when you're dealing with this every day, you can lose sight of the massive impact it has on someone's life. Prue has written in the chat question, do you supplement the discussion with written information?
I'm more than happy to be reached out to, Prue, and we can discuss and I can pass on. I think, do you pass my notes on as well, Ali? Do you normally pass them on? Is that the kind of written information that you're after, Prue, or were you after something in a bit more detail?
You're on mute.
Yeah, okay, sorry. It was more, I don't see patients with, their first diagnosis of diabetes. I work in the inpatient setting, where occasionally we do, but I just know that because people are overwhelmed by the diagnosis, they tend to forget what's been said to them. So, and you don't want them necessarily going in and Googling everything
yes,
without any direction.
Response. Yeah, of course, Prue. Sorry, misunderstanding what you're asking.
Yeah, so I was just wondering what the standard resources are that you use or would recommend.
There's certainly lots of different resources out there that we do use, and I can't say that I use a standard one for every single person. We certainly as a team have developed some resources. I also use quite a few from the Baker IDI website, and then there's also the NDSS and Diabetes Australia as well that have good resource. I also, I think it's important to ask the client because sometimes they can also be overwhelmed with all of that as well. So, and just being mindful of that, going, how about we start with one aspect and then we'll keep building on that over time as well. So it might be trying to see the client every time that I'm in the clinic to start off with, just to really help build that rapport and to get them to feel more comfortable with living with diabetes.
I find that the fact sheets on the NDSS website are quite concise for the main part. I must say I don't give, I guess, the general understanding of diabetes ones out as much as I probably should. But if anyone is starting on insulin, as a blanket rule, I always give the management of hypoglycemia in a written form, just because if they're not feeling well, having something that they can reference quickly or give to their family members is, I think, very helpful to have, or if they can just put it on their fridge. But I do find those resources actually really quite simple and easy for patients to understand.
All right. Any last questions before we move over to the case presentation for tonight? So tonight's case study is going to be presented by David Rees. He's a community pharmacist out at Condo. He's recently finished his diabetes education certificate, and I believe there's still funding for that through Care Partnership Diabetes. If somebody wants to get that certificate, you can apply for funding to do that. So well done, Dave, and congratulations on that accomplishment. So I'll hand over to Dave to present tonight's case. Thanks, Sal. What a summary. What a great bunch of contributions tonight. Thanks, everybody, for such active participation. It's been absolutely wonderful to have you all join us. Tonight's our last echo until August. However, there is the Diabetes Masterclass in Dubbo at the zoo this weekend. There are still spots if you want to join, but you haven't signed up. Please reach out to Ali and the PHN team. We'd be absolutely delighted for you to all join us. We are having an Echo Live session in the middle of the day. It'll be lots of fun. We've got fantastic speakers lined up, coming up from Sydney, as well as local diabetes experts and champions. We'd love to see you all there. On the screen is the QR link for the evaluation for tonight's session. Encourage you all to put in your feedback, any ideas, anyone who's got a case to present, really welcome them. And even if you want to do a didactic session, if you want to teach us, please reach out to Ali and the PHN team. Look forward to your contributions. And once again, thanks so much for this really exciting evening, and hope to see you all in person on Saturday at the zoo. Good night.